Hi everybody, Cait here, one of our physical therapists from our East Norristown location, here to go over my best recommendations for exercises for those of you who are experiencing low back pain that is from arthritis. All right. The first thing to determine before we even get into the exercises is, are you someone who's experiencing pain in your low back that's actually coming from arthritis? There's a lot of different structures in our low back that can cause pain, so it's important for you to determine it's truly arthritis before you do these stretches, okay? So the two questions to ask yourself: where is your pain located? So symptoms that are really coming from arthritis are going to be pretty local to the low back, just generally stiff, sore, achy, dull. Anything down the leg, numbness, tingling, symptoms into the hips, probably something else. So pretty local to the low back. Second thing, presence of stiffness, and more specifically morning stiffness. So you get up out of bed, you go to stand up, you feel like 200-year-old man trying to stand up all the way straight, and it takes you half an hour, even sometimes up to 2 hours to really feel like you're all the way upright. And the more you move around, the better it feels. That also goes along with things like sitting for a long period of time, in the car for a long period of time. Just any instance where you're not moving and then you go to move and it just feels stiff and achy. Probably, most likely, dealing with some symptoms coming from arthritis, okay? So those two things, if both of those two things are positive, you're most likely dealing with symptoms that are coming from arthritis. So my recommendations for exercise are what I like to call maintenance exercises, all right? So with arthritis, the purpose of physical therapy, we're not changing anything with the arthritis. It's there, all right? Once it's there, we're not going to change it, but what we can do is affect the muscles and the ligaments and the joints around that area to try and keep as much space between the joints as possible. So daily routine, kind of like brushing your teeth. Hopefully you're brushing your teeth at least once a day. You brush it in the morning, you brush it at night, right? It's just kind of part of your daily routine that you do to take care of your body. If you're experiencing pain from arthritis, similar concept. You just kind of get into the habit of doing these stretches on a regular basis to help maintain the flexibility of the muscles around the joints that are becoming a little bit more arthritic, okay? And the goal here, if we use the example of getting up in the morning, you do these stretches, so when you get up and out of bed, it takes you 10 minutes to get up all the way instead of an hour. Again, we're not changing the presence of arthritis, but we're just helping you manage it a little bit better. So like I said, these exercises are to be done before you get out of bed in the morning, and then throughout the day. If you do find that you're more sedentary, you sit on the couch, you sit at the dining room table, utilize these stretches every couple of hours to help keep things loose and keep that stiffness to a minimum, okay? So a couple stretches. 1, knee to chest. Sounds exactly like what it is. Pulling the knee to the chest, 5-second hold, 10 times on each side, okay? That's one leg at a time, then both knees. Knees to chest, 5-second hold, 10 times, okay? Then keeping your knees in that same position, side to side, okay? And then the last one, you turn on your side, both of your knees bent, one hand on front of the other, and you're sliding that top arm as far forward as you can, and then you're going to bring it back. This is called a bow and arrow. Okay, forward and back, 10 times each side. Okay, now you can do these anywhere from 2 to 3 sets, and if you do find some of these exercises are more effective than others, then you focus on those. All right, but these are great ways to help keep all of these muscles on either side of your low back looser, minimizing that compressive effect that arthritis plays on our joints, okay? If you are concerned about the exercises and the pain that they're producing, or if you're unsure if arthritis is really the reason why you're dealing with symptoms, give us a call, okay? Otherwise, good luck with these stretches.